Did you know that millions of women have pain during intercourse? But unfortunately, not many talk about it and feel embarrassed. Pain is common, but not normal. Welcome ladies to my channel, Zone of Empowerment. Okay, so let's start and talk about pain during intercourse, which is called dyspareunia. So what is that? Some women describe it as a sting, others as burning, and some feel a deep ache that ruins the intimacy completely. Dyspareunia has many different phases. And in today's episode, we will walk through 5 most common sources of pain. So you can finally understand what your body is trying to tell you all the time. And there is no shame, no judgment, just clarity. So let's start with the first. The first is the entrance pain, here in the introitus. So if the pain happens in the moment where the penetration begins, this is the place to look first. So here, what could cause it? Sensitive skin around the vaginal opening or dermatological diseases like lichen. It could be also overactivity or just irritation of the pudendal nerve. Another option is a very tight muscle called bulbus spongiosum due to a scar tissue, for example from childbirth or episiotomy where they cut you. And how does this pain feel? If you are out there and have this problem, you know how it feels. It's a sharp sting or burning snap or a sudden electric shock. This will be very, very painful. So, what can I recommend you to help you? You can use, let me take this, you can take soft dildos. You can use them here to open up that part a bit more, to make it softer and to make the scar melt down a bit. Or you do it with your hands, a bit massage the scar, which is very important and can change a lot. And lidocaine baths is also another option. And sometimes the solution can be so easy. You just need to change your undies from strings to the more grandma pants like seamless pants, and also patterns like sharp washing gel. Just use water. But the best would be a physiotherapist or osteopath, which is specialized in women. She can help you also and show you everything. And I want to give you a last nice information that I also just found out. There is a connection between the histamine and the introitus. Try to delete that histamine a time from your nutrition. Maybe that helps. It's worth a try. Number 2, burning inside the vaginal canal. As I just said, it's a burning feeling. It's all the time during the penetration, like a constant pain. And the feeling is like a burning or dryness. Everything feels irritated. And this often points to a acute infection or a thin or irritated mucosal layer, also low estrogen. Or it could be hormonal imbalance after childbirth and stress. Another reason could be chronic inflammation. Therefore, a simple hormone status at your doctor or a cervical smear could just give the solution really easily. Number 3, deep pelvic pain at the end of the penetration. This is the pain that feels like it's coming from the inside of the pelvis, not from the surface. It's at the end when the penis is very deep inside and then you hit the point and it really, really hurts. Possible causes could be changes of the position of the organs. Let's talk now about the uterus. When the uterus is too low, the penis doesn't hit the right point of the cervix. Even a scar tissue from a C-section could be a reason, because the scar is holding the uterus in a wrong position. Or it can be just visceral tension. Even though the C-section scar is on the abdomen, the fascia inside the tissues are all connected together. One small restriction can create deep discomfort. The treatment often focuses on the mobility of the pelvis, but internal manual therapy, which has the focus on strengthening your muscles, this is your work to do. So, number 4, pelvic floor muscle pain. Everything just feels tight, Some women describe this as a pain and discomfort, unable to relax at all. And sometimes penetration cannot even be tolerated. This comes very often with bladder-related symptoms like unable to relax. They have difficulties of starting the urination. And this happens because the pelvic floor muscles contract instead of also being able to relax. And why does this happen? Reasons can be stress, anxiety around intimacy, a trauma, injuries. For example, you could have fall also on your butt, and after a while you create those pain. Or it can be a habitual, it can be a habit, like you wanted to strengthen the muscles, strength, but never actually learned how to relax. So that's why I kind of told you already the solution of that. It's Kegel training. But no, this is just half right. It's reverse Kegel training. That means you have to learn to contract the muscles, but way more important is to learn how to relax that muscle from your pelvic floor. So breathing can help. Breathing, releasing, and also the most important for me is internal vaginal work from a specialized physiotherapist or osteopath who can help you with that problem. And relaxing and not strengthening will change everything here. Number 5. The last one is pain during orgasm. So everything is fine until you come to the point of orgasm, and then you suddenly have a pain. How bad is that? Then you should look at the numbers 1 to 4, what I just said. If causes 1 to 4 are ruled out, the most common explanation is hormonal imbalance. And once the hormones are balanced again, this type of pain usually improves soon. So thank you for staying so long. Now, I just want to say to you that pain during intimacy is never something you should get used to. Your body is actually speaking to you. Every type of pain has a different kind of message, what the body wants to give you. And also, not just a different message, but also a different solution. Visit a gynecologist that you trust, or a physiotherapist or osteopath who work internal, specialized with women, who often offers also intravaginal work. If this episode helped you to understand your body better, please share it with someone who might need that too, because I don't want that no woman have to navigate the pain alone. I wish you all the best.